Quinn thinks it's funny.
I'm really good at karate. Oh, three of them.
From playing virtual reality with her grandchildren to skiing or swimming, 69-year-old Susan Voigt says she is living with multiple myeloma.
And jump in with both feet. That's what I did.
The grandmother of 12 spent 7 years undergoing chemotherapy treatments.
I would go home and just leave my cancer at the hospital.
Then, 3 years ago, after several remissions and recurrences, she was told of a clinical trial at Dana-Farber Cancer Institute for something called CAR T-cell therapy with a drug idacaptogene visleucel, or ide-cel.
It's a product where we take patients' immune cells and then genetically modify it to give it few specific property that after the genetic modification, these immune cells can recognize the myeloma cell very specifically.
Dr. Nikhil Munshi led the study at Dana-Farber. He says the modified immune cells can then bind to the cancer cell, kill it, and in the process divide further to kill even more myeloma cells.
It's an incredibly powerful treatment.
A powerful treatment that just received FDA approval, which means it's now considered standard therapy for patients with relapsed or resistant myeloma. And a number of the patients on the trial are just like Susan, with responses lasting 1, 2, or even 3 years and counting.
And I'm still improving. That's what I can't believe, that I'm still improving after all this time.
Improving and celebrating births and birthdays, creating new memories, and a 50th wedding anniversary where she put on her wedding gown, smiling from ear to ear. Susan spent several weeks in the hospital in 2018 for her CAR-T treatment, arriving in a wheelchair, but able to walk out on her own and never having to return for another dose of chemotherapy.
I asked them, what do I do now when I go home? Well, you just live your life.